The federal government may be considering suspending dispensation of funds to the 59 health maintenance organizations known as HMOs, which are under the National Health Insurance Scheme.
This follows a series of allegations of mismanagement of more than 350 billion naira. And let's take you back to an investigative hearing into alleged fraud in the scheme by the House of Representatives in June.
It was a fierce session of allegations and counter-allegations by the major actors in the health insurance sector, each blaming the other for the systemic failure in delivering on their mandates.
Healthcare financing in Nigeria that I met is nothing but a huge fraud. It is nothing but subsidy to HMOs. Worse than fuel subsidy. Why is it worse? Fuel subsidy, they cash their checks and leave town. HMOs cash their checks and people suffer and die.
We are supposed to be working together. The ES that is seated here is unfortunate. From his first outing with us in August till now, he's not been able to meet with the HMOs on one occasion. I tell you, if there is any issue that needs to be clarified, it's not supposed to be like this.
The federal government, on its part, described the investigative hearing as a step in the right direction. It added that there are inconsistencies in the information available to government.
Access to affordable and good quality healthcare is a key element in actualizing universal health coverage goals in Nigeria. Effort by House Committee to address the challenges faced by Nigerians under the National Health Insurance Scheme is a step in the right direction.
The major financiers and beneficiaries, who are the receiving end, have called for the elimination of middlemen in the scheme.
The funds we are talking about is the funds of Nigerian workers. It is a 10% medical allowance which we have earned, that we have allowed it to be used as seed money to actually fund the scheme. The issue of the HMOs, who to my understanding are intermediaries between the healthcare provider and the end product user, who is the enrollee. And therefore there is the necessity actually to address this issue of middlemen or women.
This hearing arose out of the need to investigate the persistent allegations of poor treatment of enrollees by healthcare providers, with the latter passing the bulk of the blame to the HMOs. At the heart of this is the compliance rate of HMOs and providers to the National Health Insurance contributions and utilization of funds.
The federal government established the National Health Insurance Scheme in May 1999. It kicked off in 2005 with the aim of providing access to adequate and affordable health care to all Nigerians. Sadly, 12 years after its establishment, it's yet to yield desired results.
Okay, let's now before we begin our discussion, let's give you some information on the National Health Insurance Scheme. Now, the scheme was established under the Act 35 of 1999 Constitution by the federal government of Nigeria and became operational in 2005 after the official launch of the health scheme in June 2005. It was given a presidential mandate which was supposed to ensure universal coverage of all Nigerians by 2015 via the social health insurance.
And has universal coverage been achieved? Not yet. Well, the NHIS was created to secure universal coverage and access to adequate and affordable health care, according to what Mike has read, and by improving the health status of Nigerians through various prepayment systems. It was also established to attract more resources to the healthcare sector and also improve the level of access and utilization of the healthcare services. However, the effectiveness of the scheme remains to be seen, with many Nigerians wondering if the scheme is fulfilling the purpose for which it was set up. Now, how does the NHIS work?
Now, let's give you the basics. NHIS in its current form has programs for the different population groups. Now, those in employment have a program, the self-employed have a program, rural community people have a program, and students also have a program. Now, there is a National Health Insurance Fund established to receive contributions for any of the programs.
Well, and somehow the federal government workers are the major beneficiaries. Well, those in employment contribute 5.25% of gross pay. The employees pay 1.75%, while employers pay about 3.5% of this, totaling 5.25%.
All right, those are the basics, just to give you a foundational idea, general idea of what this is all about. Now, with us in the studio is the Executive Secretary, Health and Management Care Association of Nigeria, Ngozi Nduka Uba. Good morning.
Thank you for joining us.
It's good to have you join us right now.
We understand that your organization is the umbrella body of HMOs in the country, right? Yes. Thank you for joining us. Thank you. All right, now, we first of all want to understand the capitation, because there's been this disagreement between the NHIS and HMOs about misappropriating about 351 billion naira. And then there were complaints from some members of the HMO associations that ridiculous amounts have been pegged as capitation. For example, surgery 10 naira, and then incubator for 155 naira or thereabout.
We want to set the record straight. About 80% of the money that is paid to HMOs actually go to the providers for care. And that is what is known as capitation. Capitation is paid to providers every month by HMOs. And whether the enrollee comes to hospital or not, that capitation must be paid in advance. Now, for what you just mentioned, incubator service and all, that's under secondary care. Payments for secondary care is called fee for service. And a particular amount of money, maybe 120 naira per head, per enrollee, is paid every month to the health maintenance organization. And that is probably maybe even less than 10% of what that huge amount is talking about. So what really belongs to the HMO is what is called admin fee. That stays with the HMO.
All right. Now, we have heard instances where someone gets ill, goes to a hospital and wants to access service, and then the hospital is calling the HMO whether the kind of ailment is covered by the person's HMO or not. Why is that?
Now, let me just say this.
I know you've received a lot of this. I know you've received a lot of this complaints here and there before.
Now, there are 3 levels. We started with primary care, where, capitation is paid to the provider. That's the first level, And then you go to the next level, which is secondary, for secondary care. It's only when it comes to ailments under secondary care that you need to call the HMO for what is called referral. They give you a code. You understand that?
Yes.
Okay, so for primary care, you don't need to call the HMO.
Okay, break it down for us.
Yes.
What kind of ailment funds fall under primary care? What kind fall under secondary and tertiary, or maybe even universal care, as the case may be?
Okay, for primary care, you have ailments that are fairly common: malaria, typhoid, simple things. Even the basic test, you want to run a basic eye test, like I said, malaria, typhoid, and all that. They're under primary care. And for that level of care, you don't need to call the HMO for any referral. I'll take myself, for example, when I had issues with my knee, I saw my doctor. The very first doctor you see is a primary care doctor. And then they look at you. And when it's beyond primary care, for example, I think they said I had arthritis or something. And then they also, there's this other one. In that case, they will need to get in touch with my HMO to know whether what I'm suffering is covered by my contract. I'm private, I'm not NHIS. So they need to get in touch with the HMO to know if that particular service I require is covered by the kind of plan I had subscribed to. That process of getting that confirmation is what,
What I was asking you.
Yes.
Okay. So let's quickly look at accusation leveled against HMOs by the suspended Executive Secretary of NHIS that HMOs owe healthcare providers capitation fees. And then, of course, we have HMOs saying that that is a lie. What is the truth in this now? Do HMOs owe healthcare providers or not?
You are talking about capitation now, not
That
fee
is,
for
yes,
service.
that is what
now, like I
Usman
said,
said.
the HMO is not supposed to keep capitation. It's money that you pay to the provider every month. So you're not supposed to hold on to it. Now, if the regulator is saying an HMO is sitting on capitation, that is exactly the job of the regulator. That is why you are a regulator. If an HMO is withholding funds, what are you doing as a regulator?
Okay.
But is it possible that some HMOs are holding on to money?
Well,
holding
it's
on to
possible.
funds?
Because it's no longer prepayment, we understand that they now pay some of this money.
Well, that's what the ES did.
Okay.
Usually they get paid, the HMOs get paid quarterly, every 3 months. Okay. And then when he came on board, he changed it and made it a prepaid, a postpaid. So sometimes HMOs don't even get paid until, you know, way into the second month.
Okay.
All right, this is where we have to end now because time is not on our side. But we must thank the Executive Secretary, Health and Management Care Association of Nigeria, Ngozi Nduka Uba. Thank you for coming.
Thank you for coming.
Thank you very much. Thank you. Right, this is where we come to the end of today's edition of the program. Tomorrow, you see us again. We'll be here to talk about issues that concern Nigeria, Africa, and the world.